Dr. Desiree.
And I'm Dr. Karen, and this is your A+ Care Tip of the Day.
So today we're going to be talking about balance, and particularly how you can know if you or someone you know and love might have an issue with balance. We're going to take you through 3 different tests. They're called the Romberg, the Sharpen-Romberg, and the single leg balance test. So this is best performed with the shoes off, but you can also perform it with the shoes on, whatever your comfort level is. So the Romberg test is performed simply by putting your feet as close together as they'll go. Perfect. And I'm having Karen perform these close to a chair just for safety. I'd recommend you do that at home as well, with the wall on one side or someone you know and trust on one side and a chair on the other, just to make sure everybody stays safe. So the Romberg, the feet are together, arms are across the chest, and she's just going to try to hold this position for 60 seconds. So we'll time that. All right, perfect. So Karen performed that one with no problem, which means we'll progress to the next step, which is for her to close her eyes. So I'm going to have Karen maintain this position, but close her eyes again for 60 seconds. All right, perfect. Karen, you can open your eyes. So you might notice a little bit of swaying in your body. That's totally normal and to be expected, but as long as you can use your muscles to pull yourself back towards midline, then you're still good to progress to the next level of challenge, which is the Sharpen-Romberg. So in the Sharpen-Romberg, I'm gonna have Karen put one foot in front of the other so she's standing heel to toe. Good. Once she feels steady in that position, I'm gonna have her again put her arms across her chest. And the goal for this one is to maintain this position for 30 seconds. All right, again, Karen is passing these tests so far with flying colors, which means we're going to progress her to the next level. If you or someone you know and love has a challenge at that level, maybe you lose balance, then it would not be appropriate to progress to the next stage. I would just keep working on that, one foot in front of the other with the eyes open. However, the next progression is to maintain that same position, so heel to toe. This time I'm going to have Karen do the same thing, arms across the chest, but with her eyes closed. And the goal for this one is 20 seconds. All right, perfect. So again, you might notice some swaying, again, totally normal, but she was still able to maintain her balance, which is excellent. And the last and final balance exercise we're gonna do is have Karen just balance on one foot. So same thing, I'm not gonna have her close her eyes, but I am gonna have her put her arms across her chest. And the goal is to maintain this position for 20 seconds. All right, perfect. So if you struggled with any of those tests, not a big deal. Balance certainly can improve with practice and with intervention. So the number one tip I would give you is to find a local physical therapist who you can work with to continue to improve your balance. But in the meantime, until you're able to do or see a physical therapist, you can continue to do these exercises on your own. So again, the safest place is going to be between a wall and a chair, maybe even between a door frame so you've got something on both sides, and just continue to work on all the exercises we just showed you, and your balance will improve, again, with time and perseverance. And that is your A+ Care Tip of the Day.